Breezin with Bierman. Today, we're here to talk about health insurance with our special guest, Dr. Tony Chiurco, a neurosurgeon in private practice in New Jersey, and our frequent special guest and my colleague, Stacy Hoffer, a social worker and therapist, also in private practice. I'm the chief medical correspondent for this show, and I'm a forensic psychiatrist, also in private practice, and also here in Princeton, New Jersey. So let me begin by saying that of the three professionals here at this table, I am the only one who's still accepting health insurance as payment for my professional services. And that's because I split my time between doing treatment and doing private forensic consultation, which is not covered by any form of health insurance. So that's how I manage my niche field. But Dr. Chiurco, why don't you tell us how you've changed your practice since the blooming of health insurance in our profession?
Well, for people in my field, which is high risk, it's been a disaster. There's a problem when almost all of the neurosurgeons in New Jersey do not participate with insurance carriers. And the reason is because the reimbursements are so meager that they could not keep the doors of their office open. And when you look at the cost of overhead, private practice is dying. The reimbursements are so pernicious that a new business model, it forced a new business model to evolve, and that is employment. So what you're seeing now is over 70% of physicians are now employed by hospitals because they cannot meet their overhead with the current reimbursement. And this goes back to what is a closely guarded secret on Wall Street is the enormous profits that the insurance carriers are making. They're screwing everyone, not only the doctor, but primarily the patient. What they've done is they've forced higher deductibles, higher premiums, more of the balance of your bill you're responsible for. And look at the stock of the health insurance companies. As the S&P 500 has increased over about 70% over the past several years, the stock in health insurance companies has more than doubled. It's over about 120%.